Awesome. Thank you so much, Chris. I was waiting until I heard that magic recording noise, so I knew all the good stuff was going to get on. My name is Emily Mayer. I use she, her pronouns. I am the senior manager at the Ford and Ford Group, which does the contract lobbying for the SC United Justice and Equality Coalition. It has been an honor and a privilege to work alongside so many of you as we have advocated and mobilized and organized in this space. I'm just going to give you a quick update of where we are at with House Bill 4624, kind of give you a quick replay of the changes that have been made and what we're looking at moving forward. If you have questions, again, there's that Q&A space at the end where hopefully we can flesh any of those concerns out for you. So 4624, what does it actually say? It restricts the access of gender-affirming care for anybody under the age of 18. There is a course of treatment provision that allows anyone who has received care prior to August 1st of this year to remain in care as long as the treatment is, quote, systematically reduced. Questions arise about what that actually means, but that is a piece of the bill, and we are continuing to seek clarification and mitigate harm wherever possible as we move forward. The bill also has a forced outing and parental notification provision for public schools that would require any school nurses, counselors, teachers, principals, any school official to notify a parent or guardian if students are using a different form of gender expression via pronouns, via name, via outfit choice, expression personally. And this is for strictly public schools to follow. There is a Medicaid reimbursement ban that would restrict reimbursement for people receiving gender-affirming care at any age. This was one of the changes that we saw in the language as it moved from the House to the Senate. The House said just for anybody under 26 years of age. The Senate removed that age barrier and said anyone who is looking for Medicaid reimbursement at any age will not be able to do so. Also, anybody who, any public funding directly or indirectly may not be used for gender affirming care for procedures. So again, there's some ambiguity there in language that we are looking to dig deeper into and gain a better understanding of. And should this bill pass, it would take effect immediately upon approval and signature of Governor McMaster. So we did see some language changes throughout this process so far that we want to make sure we highlight for you. Again, that Medicaid coverage piece now means that anyone who is looking for Medicaid reimbursement at any age and receives gender affirming care for gender affirming care procedures would not be able to receive them. We did get the aiding and abetting language removed from the bill. So that would be criminal punishment for medical providers providing gender affirming care. We did remove that aid and abet language. So we did mitigate harm for our healthcare providers in that regard so far. And we have been able to clarify that youth will be able to continue seeking gender affirming mental health care through their mental health care providers. So they have said that they understand the importance of trans youth continuing to receive their mental health care, and that is no longer restricted or prohibited in the language of this bill. So where are we at now? What lies ahead of us? We have made it to what is the final stop before we get to the governor's office. We are awaiting the Senate to take this bill up for debate on the floor. We do not know necessarily when that is going to be. It could be at any moment in time. So the Senate floor is the final stop. Should they pass their language and it's different than the House language, it will have to go back to the House for concurrence, but then would be on to the governor for his stamp of approval. So this means that it is all hands on deck time, and there is no time to wait If you have not already looked up who your senator is, linked up with your senator, expressed your concern over House Bill 4624, now is the time to do so as we await the Senate floor debate and vote. Basically just reiterates what I just said. So let's make sure that our champions are hearing from you and saying, we're thanking them for their hard work that they're doing to be a champion for our voices and our children's voices. Our Republican lawmakers need to hear from you, specifically with the concerns regarding the forced outing provision and the removal of reimbursement for adults, because now this bill may have significant impact on adult trans folks who are using Medicaid reimbursement to help pay for their procedures. So there are Republicans that have been willing to listen to us, and we are thankful for that. So we continue to urge you to continue those conversations with them, provide them with the information and experience that they need to be able to have a well-rounded opinion when going to the floor for debate and vote. Awesome. And now I'm throwing it over to our organizing team. What can you do to help us fight against 4624?
Hey, y'all. I definitely just want to, before I get started on how you can dig into your power and organize against this ugly bill, I definitely just want to take a second to express all of the gratitude. I have been at the State House. I've seen a lot of amazing things coming through. And so I definitely want to thank everybody for even being here. That's an amazing step. So that, with that being said, I definitely want to talk about what you can do. Go ahead to the next slide. All right, thank you. So I know that we say this a lot, but call your senator. As Emily said, your Republican senator for sure, and request a meeting. We also are going to be doing some phone and texting banks coming up. And so we are doing trainings on those. If you feel uncomfortable, let us know. But those are in the newsletter that comes out, the links for that. So we're doing one Wednesday, tomorrow, and then on Friday. And then we're doing a power hour as well. So that's on Thursday. That's in Columbia, though, at the Harriet Hancock Center. I am very excited about that. Let's see what else we got. Go ahead. Awesome. I'm going to let Dylan talk to you about this part.
Oh, I think actually I'm going to jump in on this one if y'all don't mind, but Dylan's also an member. I'm so excited to get to work with this team. Look, I mean, I think we just want to take a second to really underscore like what a really difficult time this has been for so many folks in our community. And that community care is really important to us, as like you'll hear us talk a lot about, like you just have, about how important it is to get in touch with your senators and trying to make an impact on this legislation, which is very important, but it's also very important that we're taking care of each other and the trans youth and families of trans youth who are really being impacted in a really hard way right now. And that brings us to this point, which is that we have some rapid response grants available. You don't have to be part of an organization. You can just be a person who wants to do something in your community, or you can be part of an organization, either way. But this could be funding. They're $250 grants. The bar is super low to get these. Our goal is to get to a yes. Basically, as long as you're going to hold an event, we want to help support that. It could be funding for a support group. It could be a dinner for folks in your community. It could be hosting a rally or a protest, or doing a film screening, or holding out a healing space, or doing a community art project. Really, it's limitless here. It's just a way that we want to support the creativity and that we know exists in our community, and really help get some gas in the tank around this stuff that makes a huge difference with resilience and all of that in our community. So you can let us know if you're interested in that. It's southcarolinaunited.org/transequality. And some of the ways that we can support are processing these $250 grants. We can also share template materials and help on the back end with events like that. We can lift these up on our website to help you advertise for them, and we can send signage your way. And it's really kind of a pick and choose. You don't have to take advantage of all of those things, but if you would like to do something and any of those could be supportive to you, we really want to be here to be a resource in that way. And then also just want to preview for folks that in the coming days, our organizing team is working on putting together a healing and resilience resource guide with some resources that already exist in our community and some further ideas of how we can use art to, help enhance that healing and resilience element that we're making sure that we're centering and lifting that up, especially right now in moments like these. And now I would love to throw the ball over to Dom, I believe, with We Are Family, who's one of our incredible youth serving organizations in South Carolina, to talk a little bit about some of those resources that exist already.
Fantastic. Thank you so much. I'm going to touch a little bit on big props to, my goodness, Emily, Kenya, Ivy, the rapid response folks. This work is incredibly hard and y'all are literally there on the front line. So thank you for that. A couple of things that are happening in our little part of the world that I would love to share with y'all. My goodness, we have on April 20th, the team told me I cannot say 420, but on April 20th, we will have our queer youth prom. I'm going to drop a link in the chat as well as an email there. This is free and open to all queer and trans and allied youth, middle school, high school youth. The theme this year is osmosis. So think Wizard of Oz, The Wiz, Wicked. In previous years, we've had between 200 and 250 youth in attendance. And so that's there, as we are thinking about ways in which to uplift what it means to have queer and trans joy in sort of times, in rougher times. This is sort of like one of those moments. The email there is at info@waf.org. If you are based in the South Carolina Low Country and you want to, or not, or if you want to volunteer for this event, send an email out to info@waf.org and we'll connect you with with Cal, our volunteer coordinator, and it's a really great time and a really great event. So outside of that, I want to take another minute to talk a little bit about some of the things to look forward to from We Are Family in the coming year, actually, and beyond. So our board has went through a 6-month long, board strategic planning and direction process. And we have updated our mission and vision. And so, a truncated version of that is that we are going to, so We Are Family provides life-affirming and life-saving programs for LGBTQ young people that have a lasting and measurable impact with a focus on those who are BIPOC and or low income. With that, we are going to intentionally focus in the coming year and beyond on those programs, doubling down on those programs that are already statewide, which includes our Trans Love Fund, it's a microgrant program, as well as our gender affirming gear products giveaway program. And then in the coming year plus, we plan on have a scaffolded sort of approach on scaling some of our other programs to be statewide as well. This includes our mental health assistance program, which is free one-on-one and group therapy to queer and trans young people up to the age of 24 at no cost to them, as well as our other social support groups, Discord, and our GSA coalition support program. So thank y'all.
And now would love to throw things over to Raymond with the Uplift Outreach Center, if you're on, Raymond, to talk a little bit about the incredible work y'all are doing.
All right, there we go. We're live. Good evening, everyone. I just want to echo the same sentiments for everyone joining this call this evening. I am Raymond Velasquez. I use he, him pronouns. I'm the executive director for Uplift Outreach Center. I'm also one of the rapid response organizers for this session with SC United. So really excited and honored to be part of this team this year. I dropped in our chat our website, and I just want to talk about a little bit of the services that we provide in upstate South Carolina. Our mission at Uplift is the Uplift Outreach Center is committed to providing a safe and inclusive space for LGBTQ plus youth in the upstate. And our mission is to empower youth by fostering personal growth, educational achievement, and mental well-being, ultimately contributing to a more equitable and affirming community for all. Some of the programs that we provide is our Safer Space groups that meet weekly through various days. We provide like a welcome and supportive environment for LGBTQ plus youth, where they can feel comfortable and safe to express themselves freely without fear of judgment or discrimination. We offer like support services. We currently have an amazing mental health program. Currently just for Spartanburg County, we're hoping to expand that to more of the upstate area or for the region as a whole. We were able to cover mental health costs and fees associated with attending a culturally competent mental health provider. You know, when we're kids and youth and thinking back and just to when I was younger and having mental health support or affirming care at that time definitely would have made a difference. And I'm sure many of us can relate to having more equitable access to mental health support. And we also provide educational resources and access to other community resources. We provide like empowerment and community engagement as well. Another core part of our program is educational workshops. They cover usually a wide range of topics, which is managed by our wonderful program director, Jody Snyder. These workshops typically include like LGBTQ plus rights, workshops on identity, sexual health, healthy relationships, harm reduction, education, HIV and AIDS, and other STI education as well. Just social gatherings, cultural events, advocacy activities, just to foster a sense of more of community and promoting LGBTQ plus visibility. Our organization serves ages 13 to 20 with 3 different groups. We have our tween group, which we call our teen group, and as well as our young adult group as well. And we love partnering and collaborating with other local organizations and mental health providers, as well as schools, other community leaders to ensure that success and sustainability of our programs and services. So we're just dedicated to providing resources, support for our youth in the upstate. And please drop our website in the chat as well. I would like a quick plug too of our Rainbow Ball, which is our biggest fundraiser of the year, which takes place this May. You'll be able to find more information on the website as well. So thank you.
Oh, thank you so much. So we've heard about some really incredible resources and fun events where folks can plug in the Low Country and in the upstate. And now we would love to hear from Chase, who runs the youth program with the Harriet Hancock Center. If you have a second to tell us some about what's going on there.
Absolutely. Hello, everyone. My name is Chase Morin. I use he, him pronouns. I just want to kind of echo Domenico and Raymond as well. Thank you so much to all the organizers of this event, this town hall. It's so exciting to hear about the programming in the upstate and down in the Low Country. As Ivy said, I am the volunteer coordinator for the Youth Out Loud program at the Harriet Hancock Center. We are very much kind of in the infancy of relaunching the program. It was really a flagship of the Harriet Hancock Center pre-pandemic. So I'm looking forward to connecting with both of Domenico and Raymond to get some good ideas for continuing to grow our program here in Columbia. We serve youth, LGBTQ youth 11 to 17. There's 2 main components to the programming that we provide. The first is peer support. We have a once monthly peer support group meeting at the center. It's always on the second Sunday from 5 to 7. That really is very much peer support, peer-led. I'm there to facilitate conversation, but it's what the youth are bringing to the meeting to process. We schedule conversations around various topics, what's going on. It's really about a place for them to come feel safe, have that inclusivity, and process what's going on in their lives. And then the second component is more of a social support, community building component. We go out into the community, hang out, go to the movies, bowling, art museum, or sometimes we host events at the center. That's more of a social component. terrarium building, movie nights, those kinds of things. So those are the two components of what the programming that we have currently for youth. And again, that's 11 to 17. And I can drop the website if you have any questions, or if I know anyone that would be interested in joining us. There's an intake form on our website. All the youth need to do is complete that intake form, and then they're welcome to join us for either of those two meetings that happen twice monthly.
Thank you so much, Chase. Thanks for being with us this evening. And so I know that we're fighting this bill. We're trying to not get to this place of if it passes, but need to be prepared in case it does, and would love to throw the ball over to Riss again.
Hey y'all. I just want to first, before we start the section, talk about how it's not fair that we have to have this town hall. Like no one should have to fight for their basic right to live and to live in their most authentic self. So I just really want to speak to that. And I'm so grateful that we had all of our previous partners talk about not only the services that they provide, but a lot of the events that they are doing to just bring joy, because that is really what we deserve, right? Is to be able to like bring this joy to our community and to ourselves, because that is really what we deserve, right? Is just to be able to live in peace and joy. But unfortunately, we are not in that moment right now. And I just really want to talk about what would happen if this bill does pass. We are doing everything that we can to fight it, but we want to make sure that y'all are prepared as much as possible for this to pass, as it has done in many other states, including, you know, our neighbors to the north in North Carolina, who just saw this pass last legislative session. And so with that being said, at SC United, with our coalition partners, we are going to continue to share resources and support families and individuals with information and community care, and trying to get y'all what you need to be able to continue your care in the safest way possible. Next slide. So first things first, if your child has started gender affirming care, reach out to your provider as soon as possible. A lot of these providers are going to interpret these laws differently. So planning with your provider and making sure that they're in the know and being able to start their own planning is going to be incredibly important. A lot of these laws are written to be somewhat confusing. A lot of them are written to like just essentially like with the intent of scaring people to be more compliant than they have to, right? So being able to talk to your providers about how they're going to interpret the law will give you a better understanding of what your next steps are going to be. If your child has been considering gender affirming care but has not yet started a course of treatment, reach out to the Campaign for Southern Equality ASAP. They are part of our steering committee for this coalition, and they are doing a lot of work to be able to connect people with care and as soon as possible. So that way, and they will be able to connect you with providers who might be able to fit you in as soon as possible as well. And then next step. Next slide. Oh, you already did next slide. Sorry, my brain did not register that. Okay, so if you're a transgender adult insured by a state employee health plan or insured through Medicaid, reach out to your current provider as well. I think you're noticing a theme, right? Is reaching out to your current provider to figure out their interpretation of this bill and the way that it will affect you. So in this particular instance, ask them how they're going to interpret the provisions around public funding. And then you're going to want to, again, get into touch with us at SC United so we can learn more about your story. Because you know, we want to be able to uplift your stories as well, because very often, like when they talk about this bill, they're not talking about your specific story, and we want to be able to make sure that we're able to highlight that. And then if you are a transgender adult of any age, reach out to your provider ASAP. Ask how they're going to interpret it with the provisions, and if they will still be able to provide you care. Many providers may not be impacted, but some may be. Even if you might not be utilizing an employee health care plan or are insured by Medicaid, those providers may still interpret this bill in a very specific way that can interrupt your care. So we want to be able to make sure that we know it, and we want to make sure that y'all are prepared for it as well. And then I'm going to go ahead and pass it over to Carolyn, who is going to talk about a little bit more in depth about what you may be able to do if this law passes.
Hi, thanks so much. Hi, everyone. My name is Carolyn Jones. I use she, her pronouns, and I'm the program manager of the Southern Trans Youth Emergency Project. And I just first wanted to say that there are so many pieces of this bill that will be devastating if it passes. And the SC United team and partners in South Carolina are discussing different interventions for the adult pieces that we just talked about. Very few of the bills that have passed across the country attacking youth have had such broad implications for adults. So it's new territory for our program, and it will require a different intervention. And we're thinking about what that intervention might be. But what I can speak to is how the Southern Trans Youth Emergency Project has been supporting families of trans youth across the country. This is a project that we have built that can expand and will expand to South Carolina if the bill passes and it's time to find care for trans youth in South Carolina. So the Southern Trans Youth Emergency Project supports families of trans youth by helping parents and guardians understand their options for continuing care for their child, including traveling out of state into safe states when bans pass in the state that they live in. We offer referrals to medical providers in our regional network, including providers in places like Virginia, as well as providers a little further afield for families in South Carolina. So families reach out to us, me, or our other patient navigator, hop on the phone and talk them through their options and make sure that they get set up with a couple really great choices of places to make an appointment. We also are able to offer grants of $500 to these families. We know that this care can get expensive, especially if you have to travel for it. And those $500 grants we're able to offer every 6 months to these families. People can use these to towards any part of the care. It could be to help refill the prescription. It could be to help pay for gas money, anything else like that. We also just offer an ecosystem of care, collaborating with providers as well as organizational partners, like many of the organizations on this call tonight, to make sure that people feel really supported and also really understand the bill and how it impacts them. So yeah, as I mentioned, we just want to make sure that you know that no matter what, if this bill does pass, we will be there to support you and your family in figuring out some next steps. We'll of course keep you all updated if the bill does pass as to what the next steps would be in order to reach out to us. But in the short term, if you're looking to identify a provider in order to initiate care, please feel free to be in touch. The best way to reach out is southernequality.org/STYEP, STYEP, and we'll throw that link in the chat so you know how to reach out. And I will pass things back to Ivy to close us out.
Yeah, thank you so much, Carolyn. Thank you everyone who's shared so far. The recorded portion of this is about to end. And then the Q&A stuff is off the record, but we'll have some time to take questions. Y'all can pop those in the chat. And we've also got a few that we're going to dive into in just a minute. But I did want to take a second just to say, we were able to lift up 3 really incredible organizations that serve youth on this call tonight, but we also know that there are lots of other really incredible advocates for our community who are on the call. So please don't hesitate to drop additional resources, events that you have upcoming, anything that you want to make sure that community members know about in the chat. And we would love to compile those and make sure that those get sent out to folks too. So if you didn't have a speaking role, but you've got stuff going on that you want to make sure people know about, please drop it in the chat. Share that with us. We want to stay in the loop and be connected with y'all and help lift up your incredible work there. Now I think we're going to stop recording.